One of the major concerns with testosterone therapy is hair loss. The question is, does it cause hair loss or does it not cause hair loss? And the answer is yes and no. So the answer is somewhere in between, and I'll explain why. So testosterone does is convert to an element called DHT, or the derivative of testosterone. So T is going to go into estradiol, and then it's going to go into DHT. And these are where a lot of the benefits are. So the DHT is what affects your sexual function. It affects a lot of mood elements, and it also affects your muscle mass. So it is very beneficial to have the DHT. The problem is that DHT is also what causes hair loss in men. Think about it as almost like a weed killer if your hair is grass. So here's your guy here, right? And the testosterone that's coming into your body, the DHT that breaks down out of it, will affect this hair, and it causes what we call androgenic alopecia. So the androgen, the hormones, the DHT coming in causes miniaturization or shrinking of the hair follicles over time. So what this results in is the hair not growing as long, so it doesn't become as thick, as strong, as bold, okay? Because the phase of growth actually gets shortened, okay? So usually 85 to 90% of your hair is in this growth phase, and then it's in the resting phase for 2 to 3 months, and then it drops out of your head, right? So if you shorten that growth phase, the hair kind of gets weaker and weaker and smaller. What you see typically is crown of the head and in the hairline. Up front is where this happens first, and that's why the characteristic like M shape in men's hair, as you see their front, like little areas here start to fade. Those are the areas that are most susceptible, and also the top of your head. And what are the statistics here? Hair is like a ticking time bomb, you know? For most men, DHT is going to affect your hair. So statistically, 20% will see some kind of effect on their hair by the time they're 20 years old, which is super early. And you might see people, know them your life, they've lost their hair really early. And it goes on like that, 30% by 30, 40% by 40 shows will see significant hair loss, 50% by 50. So like half of men out there will have some kind of hair loss by 50. And when it gets to 60, it just accelerates it. By 60 years old, 80% of men will have had some sort of androgenic alopecia or hair loss because of the DHT that's in your body. So does testosterone cause hair loss? Studies would show not any more than it does if you did not take it. So does that make sense? So if you're genetically predisposed to have hair loss, whatever testosterone in your body was going to cause it is already causing it, and giving it more testosterone does not cause it. And this also goes back to the saturation model theory of hormones. So once a tissue gets a certain amount of stimulation from a hormone, you can maximize that amount, and then giving it more hormone will not make a difference. So if your levels of testosterone are inadequate, meaning not low, under 250, your hair follicles are already at maximum stimulation, and giving them any more DHT will not make a difference in how much it's affecting you. So it all comes down to, all right, well, genetically, are you in that 20% by 20, 40% by 40, 50% by 50? And if you are, that's just the cards that were dealt. And like I said, most men will experience it at some point or another. So the bad news is hair loss due to DHT is just a thing, and most men will get some. But what can you do about it, right? So one of the things you can do about it is block the DHT. So this DHT goes to estradiol, right? And the testosterone goes to estradiol, and it goes to DHT. So you can block that DHT right here, okay? There's an enzyme called 5-alpha reductase. If you use a 5-alpha reductase inhibitor, you will block the DHT. And one of those things is finasteride. Now that's probably the most popular one. Finasteride will reduce the enzyme that converts this to DHT, so you get less DHT in your body. So if that DHT acts like a weed killer on your hair, on that grass up here, right? You reduce the amount of production of that weed killer, and then you let the hair follicles grow longer. So you let that growth phase keep going on, and then the hair gets stronger and more robust, and you get less loss, right? So what you're doing is you're stopping the loss, and if you're still growing regularly, then great, you might recover some hair. But this is not like directly to grow hair. It's really to stop the loss, if that makes sense. So whatever growth you have is not accelerated. You're slowing down the loss. Another way to do this is called Dutasteride. So studies with Dutasteride are showing that it's better than finasteride, even though finasteride is the one that you hear the most. Alopecia is the commercial name that you might have heard before, but that is finasteride, okay? Dutasteride is a little newer as far as our research shows its ability to stop hair loss, because finasteride stops a type 1 isoenzyme of 5-alpha reductase, but Dutasteride does type 1 and type 2. And the thing is, type 1 is more for hair. So that's why Dutasteride is the more effective way to stop the DHT from affecting the hair follicles. Okay, so if the 5-alpha reductase inhibitors are the way to stop the weed killer, what can we do to maybe get more growth? And to get more growth, that is Minoxidil, okay, or known as Rogaine. If those are the weed killer stoppers, this is the fertilizer, all right? So you want to do something to grow the hair back. At the same time, you can stop the hair loss. So finasteride, Dutasteride, those are the stop hair loss. Minoxidil, that's to get hair growth going. And that's like 40 or 50% success rate or so and of regrowth. And if not, it also slows the Minoxidil, that also slows the loss somewhat as well, okay? So what does Minoxidil do? It is anti-inflammatory. It is also a vasodilator, which means it increases blood flow. It also increases growth by some complex mechanisms I will not go over. And those three things will make the hair grow faster or stimulate the hair to regrow. So Minoxidil, fertilizer, finasteride, Dutasteride, stop the weed killer. Of course, the last way to combat this hair loss that is just going to happen in men in some fashion or another, in the majority of men, is hair transplant. So I had a good friend successfully do this, and you just get hair transplanted from another part of your body onto the top or onto those areas which tend to have the loss. So you're moving the hair from the places that tend not to or to go last, right? Like the back and the sides, up to the top, right? So I'm not a hair transplant expert, but I know it's done, and it is done with success. One last thing I do want to caution is not very prevalent. So on the rare side with finasteride, right, is post-finasteride syndrome, okay? And what this is basically negative side effects from finasteride, bad negative side effects that last a long time, including big mood swings, depression type of changes. One of the most concerning symptoms of post-finasteride syndrome is erectile dysfunction for men. And I mentioned this because these are serious side effects, but they last for a long time. We're talking like months to years in some people. And they say they're irreversible. So there's a slight chance with finasteride that you have permanent erectile dysfunction. Right? We've seen that in cases you can restore that with a lot of testosterone. So you get the DHT back up really high, and then it restores those functions. But blocking DHT is not a good thing generally, okay? So if you block DHT with using finasteride and you're not supplementing with testosterone, that's likely not a good idea, because you lose all the benefits of DHT, like the sexual function, the mood, the neurological function, the brain cognitive function, the muscle mass, all those things that you take testosterone for. You're actually cutting out a whole bunch of the benefits. So that's it for hair loss. Hope you learned a lot. And if you have any questions, throw them in the comments. And if I missed anything, then I'll try to answer you there.